just work in there. You can sort of see big pit marks in there, and where I was really grabbing around here, you can see my hand marks on there as well. But what I want to do is just work out along the top of his sacrum a little bit as well. So I can go right in here, and then I can kind of work out there. So a lot of times the spot's just in here, but they're still a bit stuck. Anybody watching out there that's had acute lower back pain will be going, yep, that's me, give that to me. G'day, it's Ninja here. I've got Jace as
Hello.
my model today. Happy New Year.
Happy New Year.
Yeah, today I want to show you what to do post acute lower back pain. So it's something that I kind of resonate really strongly because I've experienced it a lot. And you know, when you're going through that really acute phase, and it's just hard to turn over and things like that, I think a lot of times you don't really want to be touched. You can kind of work into it a bit yourself, intuitively and things like that, but mostly you just need to get through that initial phase. But once you're through that, then you can kind of take your healing to another level by working on the stuff that's stuck still. You know, you're pretty good, but yeah, you want to get some treatment done. So a lot of times you'll really have a specific spot where you can feel like it's stuck and it's still painful a bit. And what we're going to do today is just really work into those kind of areas. So this one, we're working into the money spot. So we want to go nice and slow and work in deep, but it's the most important thing is connect in with that pain. So a lot of times you intuitively know that you know, it needs a little bit of help. You know, things are a little bit blocked. So we kind of say, you know, when the pipes are blocked in your house, you can kind of do so much. You can pull so much hair out of your plug hole and things like that. But when it's a bit more sinister, you call the plumber. So that's kind of the analogy we use as well. Like a lot of times we're just plumbing and we're trying to get things to shift out of where they're stuck, and then the body can do the rest. Can heal itself, but sometimes we just need that bit of an outside help from somebody that does this sort of thing all the time. They specialize in unblocking the human body, and yeah, they can help you heal, help the miracles happen, because like every second of our life is a miracle in a way, that everything is functioning, our heart's beating, you know, we're breathing, you know, the nervous system is firing, got digestion, we've got circulation, we've got all these different functions going on, systems that work together, they're not just separate. So yeah, we're trying to work on all these things to help them to heal. So that's all it is. So I'm just working on a spot like this. So the spot like in here on me, which would feel really good, is just to work right in between these spaces. They've got all these little muscles in here, like the multifidus rotatories.
Yes.
Yeah. But it's sort of when you've kind of, you feel like you've done some damage when you're lifting or whatever, and you feel like there's a separation in there. You kind of feel it like it's disky and things like that. A lot of times your body just really locks up, and then it kind of protects, it makes it stronger and protected, but the movement is nowhere near as what it's like when it's functioning normally. So what we're trying to do here is, now that acute phase is gone, we're trying to really work in to the spots that really need to be relieved, because they're still in that protection mode, but the danger's gone. So we're trying to relax things, but work right into where it's still stuck that little bit, and then the function can come back. So right in there like that. So it's pushing down, but in sideways, and then right into these kind of little spots. How's that feel, Jace?
Feels good, yeah.
And yeah, that's the thing, like you just know when somebody is engaging with your spots that are stuck, the pain. That was one of my pledges 26 years ago now, was I remember sitting out in a car park and working on my own neck after I'd paid good money to receive treatment. I had certain pains and things that I knew were in my body, and yeah, I was sitting out in the car park working on my own neck, and I just, in that moment I said, no one's going to be out in my car park working on their own body after they've seen me. So it's just sort of that pledge that I'm going to work where the person identifies where they got their pain, and then make sure you at least work into it, hold it, work it effectively, and then if that doesn't really bring about change, then you can kind of branch out from there and try and find where the source is, and you kind of can go on the leads, but it's like an archaeological dig. So what I've kind of explained to people, you don't know what's beneath the surface until you dig, you push into it. But if you're digging for artifacts, something that's valuable, you don't want to just go with a big loader and just smash up, valuable things. So we've got to go in with care and respect and honour where the person is at, because sometimes it's raw and you can't work it. It's not ready, So you got to kind of honour that kind of the situation, and then work accordingly. You can work around it or things like that. But sometimes the person's not ready on a physiological level. The tissues are still raw and they're still knitting together, it's still healing, or emotionally they're not ready to kind of go into that pain again because of the trauma and what that represents to them. So you just got to honour that and go at the pace that the person is comfortable with. So, and that's our job, is to hold space, make sure people feel safe, they feel like you know what you're doing, you're competent, and you're honouring that person. So we're people, we're humans, we're not machines, so it's a really important point to remember. So just work in there, you can sort of see big pit marks in there, and where I was really grabbing around here, you can see my hand marks on there as well. But what I want to do is just work out along the top of his sacrum a little bit as well. So I can go right in here, and then I can kind of work out there. So a lot of times the spot's just in here, but it's still a bit stuck. Anybody watching out there that's had acute lower back pain will be going, yep, that's me, give that to me. Because these are the spots that are still have lingering kind of tightness and pain from time to time when you've been sitting for a long time. You'll identify with that. You've been a long car trip or been sitting on an office chair or on the couch for a long time, and then you go to move and you're like 50 years older than what you actually are. And then this is the way to relieve it. So get right in there, connecting with it nice and slow and deep, and work the tissues until they melt. So yeah, that's it. So post acute back pain, this is what you need. So be intuitive, work with the person, don't just get worked on, inject it into, work with them, and you can direct it because it's your body. So yeah, if you want to learn how to do more of this sort of stuff, look in the links, and maybe you can do our course, the Bodywork Bible, or mentorship, or in person. We're going to run soon as well. So yeah, check us out, and give us a subscribe, a like, and a follow, and share, all that kind of stuff. Yeah.
Done.
Thank you. Done.
Thank you.